Very glad is always here. Kasi ang hirap po biyahe.
Yeah, beautiful. Nani?
Hello.
Hello po. Hello. Good evening po sa inyong lahat. Sino po ang first time na naka-attend dito? Okay. I was asked kung ano daw po ang magandang topic na i-share namin sa inyo. So what we'll be sharing with you is about a natural kidney dialysis program. In 1996, I was in Palawan, and I was working with a nephrologist doon, si Dr. Ruth Miraflores. And kami sa alternative medicine, siya naman conventional. She was the only nephrologist in the island during that time. And one time, the patient came for dialysis. So pumunta siya doon. Nagkataon, Dr. Miraflores was not around. So sabi namin, 3 days pa po, she's still in Manila. So it will take her about 3 days to get here. So I saw the patient, ang baba po ng kanyang pula ng dugo, no, yung red blood cell niya, ang taas ng creatinine niya. He was very pale, he looks not so good, his legs were swollen, and he had to climb up to the 3rd or 4th floor where we were at, sa Silvertown building in Puerto Princesa. So nagkatinginan kami ng isang dentist doon who's also doing alternative medicine, and we looked and said, alam nga namang wala tayong gawin. And the patient looks not so good. So sabi namin sa kanya, we can do something, we can help you in the meantime na the nephrologist is not around. So what we did steam bath, we did acupuncture, we give some herbs, some blood purifying herbs, some herbs for the kidney. Then the next day, pag-akit niya, maganda na ang kulay niya. So we kept doing that for 3 days. And on the 4th day, dumating si Doktora, and she had him do a repeat blood test. Sodium, potassium, creatinine, CBC. Na-shock siya kasi nag-normal in 3 days time. Na-shock din kami kasi ang turo sa amin sa medical school, once damaged, always damaged. No? There's no other way to lower creatinine except to give to do dialysis. Then later on, in the martial art, pag nagma-martial art ka and you have to go to the restroom, the sensei or the teacher will say, no, you continue exercising. And after you finish the whole 2 hours training, you go to the restroom, you cannot urinate anymore. Na-sweat out mo yung toxins, yung ihi, yung urine. So from that point, we started to fine-tune the kidney program that we had. So I went back to the States for another half-year training in alternative cancer management. Pagbalik ko, I asked Dr. Miraflores, I went to stay for 1 year in Colorado, and then I came back in Palawan. Sabi ko, kumusta? Dr. Rhodes says, it's working. Then I went back to States for alternative cancer management. Pagbalik ko, kami tinawagan sa Subic to set up a wellness department sa isang hospital. And being in hospitals, patients started coming. And that's where we fine-tuned the program. So I will be sharing with you, actually this is a lecture for doctors. But I think, being in alternative medicine, may mga do's and don'ts when you're giving herbs. Isa po sa very critical patient na hindi mo pwedeng bigyan ng herbs ng basta-basta are kidney dialysis patients. Kasi they're unable to process potassium normally. So ang mga herbs po, mataas ang potassium. When you give a potassium-rich herb to a patient with a kidney disease, pag tumaas po yung potassium, they can have a heart attack. So they will blame the herb, they will blame the company, they will blame you. So it's important that you at least understand the basic principle or guideline para maski kayo, you can teach those whose creatinine may not be that high, maturuan mo. Kung ma-prevent mo siyang hindi mag-dialysis, well and good. No? Kung may share mo lang some do's and don'ts, malaking bagay na po. And is to share with people that there's hope even when they are given no hope anymore. No? So, itatry ko pong i-simplify siya para hindi masyadong technical. So, this is an alternative program for kidney disease. Although, pwede mo siyang gamitin habang nagda-dialysis yung pasyente. Kasi most of the time, when the patient has kidney failure, nakita naman natin yung mukha niya. Nakakita na ba kayo ng nagda-dialysis? Okay. Nangingitim sila. Okay? And I will explain why. Kaya meron tayong whiteboard. I'll be alternating between the board and the... Pagkatapos po nito, marunong na kayong at least mag-guide or maggamot ng siraang kidney. Yan. Pero kasi kailangan po ng mga laboratory yun. Kaya huwag masyadong malakas ang loob, no? Ano ba to? Yan. This was after 5 years of our stay in a hospital dun sa Subic. It became the Subic Bay Medical Center. But prior to that, ang pangalan po niya was Subic Legend Health and Medical Center. It's a 200-bed capacity conventional hospital. The most modern hospital nung time niya in Subic, in Zambales, and in the Bataan area. Kasi mga Amerikano ang may-ari niya before. And then the Singaporean and Malaysians were the one who started it, opened it up in 1998. And 2003, dumating ang Amerikano, they took it over, another group. Then 2007, nagsara po sila. No? 2005, I think. Nagbukas sila after a few years. Iba naman may-ari. Ang pangalan po ngayon niya, George Dewey Wellness and Medical Center. Now owned by Dante Ang, yung owner ng Manila Times. So, usually po, pag nagkukwento kami sa mga doktor, nagbibigay kami ng mga example ng mga kaso na aming nahawakan. We call it case presentation. So, ito po ay si Mr. AG, no? Hindi ko na sabihin pangalan niya. He's 65 years old from Guagua. Dumating siya sa amin, ang creatinine niya 1,400. Sa protocol po namin, pag 700 to 1,000, we advise dialysis. Kasi mahirap ibuno. Mahirap pababain yung ganong kataas na level. Kaya pababain pero ang hirap. So, it makes our job easier if the creatinine is a little bit lower. Pagka mga 300 and below, outpatient lang po yun. Bigyan lang namin ng advice. Gagawin nila, bumababa na. Pag less than 500 at walang complication, the same thing. Although kino-confine namin pag medyo may problema like diabetes, high blood, o iba pa. Between 500 to 700, pwede pa pong hindi mag-dialysis yun. 700, pwede mag-dialysis. Kung may komplikasyon, dapat mag-dialysis siya. Kung wala, optional. Pero pag 1,000, ayaw na namin hawakan. Kasi gusto namin, pababain muna niya sa dialysis para pagdating sa amin, less ang problema namin. Sa kanya po, 1,400, ayaw niyang mag-dialysis at ang baba po ng pula ng dugo niya. Ayaw din niya magpasali ng dugo. Ayaw din niya magpa-inject para tumaas yung pula ng dugo. So, pinag-sign namin, yung first week niya nag-stay sa amin, umakyat pa ng 1,600 ang creatinine niya. Bakit tumaas? He lost some weight. So, although ang diet niya is healthy, pag natunaw yung mga fats mo, para kang kumain din ng fatty food. Tumaas yung creatinine niya. But, he still would not do dialysis. 2 times siyang nag-collapse sa taas ng creatinine niya at sa baba ng asin sa katawan. So, ang blood pressure po niya, 160/110. At tapos po, ay nasira ang kidney niya dahil sa mga kidney stone. So, na-confine po siya sa Subic Legend Health and Medical Center. And ito, yung sinasabi ko, pinapirma namin kung ayaw niya magpa-dialysis at ayaw niya magpa-inject at sali ng dugo. So, anong ginawa namin? May diet po siya, no? Tapos, binalutan po namin yung katawan niya ng uling at binalot namin ng plastic o cellophane. At pinapawis po namin siya ng mga 2 hanggang 4 na oras every day. Ngayon, bumagsak yung asin niya. So, tapos nung bumagsak yung asin niya, pinakain namin siya ng sodium chloride. Ayaw pa rin tumaas. Isinwero namin yung asin. Ayaw pa rin tumaas. Ang sira po ang kidney, hirap silang mag-absorb ng asin at hirap din sila mag-keep ng asin. Ang nagawa po namin, nung hindi namin mapataas, inilagay namin sa panglabatiba, sa enema. Then we did the enema, yun biglang taas. And nung lumabas po siya, ang creatinine niya was 400 after almost 3 weeks. Pinagtrabaho ko siya sa bukid, no? Bumalik siya, 260 na lang yung creatinine niya. And then, hanggang sa napanormal po. So, yun naman pong sumunod na pasyente, siya po ay for quadruple heart bypass. Yes?
What about this thing now, today?
He's okay. He's okay. Yes, he's okay. So, this patient is from Bataan, Dinalupihan. He's supposed to be for quadruple heart bypass. So, what they did is they did an angiogram. Nag-shut down yung kidney niya, nag-react sa... Kasi 10% of patients undergoing angiogram will suffer a kidney or a liver reaction. So, he was one of the 10%. When his kidney shut down, they had to stop the angiogram. Then, nakita na nagtaas yung creatinine, so they did dialysis. Yung dialysis po, dalawang uri. Isang peritoneal, pinubutas yung tiyan. And the other dialysis is hemodialysis. You put a tube here, temporarily, so that the blood will flow through the machine and then come back. His heart was reacting, so hindi siya pwede yun. So they did a peritoneal dialysis. And he was doing it for 2 years. Well, he spent about 75 to 100,000 monthly for the next 2 years. He lost quite a lot of his properties, and he tried to kill himself 3 times. Obviously, unsuccessfully, no? Then they heard about us and he came. So since nagda-dialysis naman siya, inisip ko, hindi ko na siya i-admit. Turo ko na lang yung gagawin niya. So usually we will spend about an hour just talking with the patient and explaining, ito po yung sakit nyo. We try to simplify what they can do at home, and then we told him, okay, you do it, we should have herbs, you take this, it will help clean up the blood. And kasi yun yung sa Palawan, we didn't even admit so he went and did it. No? He came back after a week, maganda naman progress, then we never saw him again. However, after, kasi nakita ko po siya mga September yata yon or August. However, in December 2002, kasi January 2003, darating yung Amerikano to take over the hospital. So the Singaporean Malaysian were letting it go, so the American group was taking over. We didn't know if the group is still, if the American group were open to alternative medicine. So we were beside the beach at Boardwalk sa Subic. We were having our sundown worship and asking God for a sign, no? Kung magpapatuloy pa kami, we will still continue with what we're doing in Subic. And along comes this guy. Sabi niya, Doc, I'm your heart case patient. How are you na? No more block. Wala na yung 4 blocks that is for quadruple heart surgery. And then he said, I just followed what you said. I took the herb. I'm not doing dialysis anymore. At hinila ko siya. So there in front of the staff, he shared what he did. And he was almost crying when he said he tried to kill himself 3 times kasi hindi naman niya sinabi yun before. And so we felt it was God saying to us na, go ahead, no? Don't be afraid. So in 2007, he visited us. He was still in good shape. Sabi niya, he was telling people at Heart Center to come to us if they had a heart problem or kidney problem. But sad to say, none of the people he talked to at Heart Center ever came to us. Yeah. So we have 2 kidneys, the left and right. Hold them up high. So clean and bright. The blood comes here. It goes to this, we call it sinusoid, no? Pinifilter niya. If the blood comes here, it's filtered by these tiny little tubules. And then yung toxins po is collected in here and it's eliminated out. Then the good things are reabsorbed and goes back to the blood. So ganun lang po siya kasimple. These thick areas would be your filtering mechanism. So pag mataas ang blood pressure, the pressure of the artery is so strong na lumalaki itong mga space na to. So nagiging thin na yung area na magpi-filter. It also damages these capillaries, these small tubes, because of the high blood pressure. So yung high blood po, pag hindi na control at matagal na panahon, can be a source of damage to the kidney. Unfortunately, the drugs used for hypertension or high blood also damages the kidney. and also alcohol, also caffeine, coffee, also mga soft drinks, nakaka-damage din po siya. So there was an open forum in a television show, and there were 3 or 4 Philippine-based nephrologists that were interviewed. They were asked, how do you prevent damage to the kidney? They don't know. How do you keep the kidney healthy? They don't know. All they know is if it's damaged, you do dialysis or given some vitamins, and that's it. And recently, may nag-blog from Nurture Spa. She went to Nurture Spa. She did the program cleansing in Tagaytay, and then nag-blog siya na apple juice and some fruit juices can help prevent liver cirrhosis in the of course the liver. Nag-react agad yung isang gastroenterologist. Sabi niya sa we like your magazine, but when you're talking about medical things, there's juice cannot prevent liver cirrhosis. Ang cause po ng liver cirrhosis at damage sa kidney, toxins or free radicals. Ano ba ang pang-counteract mo ng free radicals? Antioxidant. So saan ba nanggagaling yung antioxidants? Fruits and vegetables na fresh. So I was thinking of reacting then doon sa gastroenterologist. I was gonna say, sabi kasi nung gastroenterologist doon sa nag-blog, doon sa author ng magazine, we like your magazine, but when it comes to medical things, please don't talk about it, or something like that. I was gonna say, yeah, it's true. Doctors, the gastroenterologist really doesn't know things to prevent damage to the liver. They don't even know how to keep the liver healthy, so don't refer. The medical field doesn't know how to prevent disease. They only know how to treat disease, but not even cure it. Diba? So, nakakainis. Kaya lang baka ma-insulto sila, So, the 2 kidneys are very much active and cleanses 100% of the blood 24 hours a day, 7 days a week. So, i-drawing natin, 100% of the blood, 24 hours, 7 days a week. That's how faithful our kidneys are. So left and right po yan. Now you have 6 major function of the kidney. One is fluid balance, elimination of fluid, fluid, tubig, Number 2, toxin. Yan. 3, control of blood pressure. 4, elimination of production of red blood cell. 5, yung sodium, potassium, calcium, and phosphorus elimination and control, And 6, protein and sugar conservation. Kailangan hindi tumapon yan, A filter works best kung it throws away what it should throw away and keep what should not be thrown away. Pag sira yung kidney, yung good na natatapon at yung bad na nare-retain. So it's a malfunctioning filter. Okay, the kidney, 1/3 of the kidney purifies the blood. So, kung ito yung kidney, dalawa, Yan, ito po yung ureter, ito po yung bladder, yung pantog, Ito yung urethra. So, iipunin po yan ng ihi. When you feel the urge to urinate is because puno na or lagpas na ng kalahati yung laman ng pantog nyo, Okay, so, halimbawa po, 1/3 ng kidney ay nag-filter, 1/3 nagre-rest, 1/3 nagpe-prepare to filter. So if you'll notice, they have maybe an 8-hour shift, each 1/3. Parang sa factory, If 1/3 of the kidney gets damaged, of one kidney, you still have 2/3 na magpapalitan. And you will check, the creatinine will be normal. The creatinine would be your waste material. When we eat, we produce creatinine. When the body functions, it's a part of your metabolism. Para bang nag-inhale ka ng oxygen, pag exhale mo, carbon dioxide. So obviously, kung madalas ka mag-inhale, you have a lot of carbon dioxide to eliminate because you're breathing. So, sabihin, if you eat more often you produce more creatinine. So the problem is it's not getting out. So the more often you eat, the more it builds up in the blood. For diabetics who needs to eat more, no, they actually produce more creatinine because of that practice. Okay, let's say nasira yung 2/3 ng kidney. You still have 1/3 here and the other 3/3 there, no? So normal pa rin yung creatinine. Let's say nasira yung 1 kidney. You have 3/3 here. Normal pa rin yung creatinine mo. Let's say nasira yung 1/3 ng natitirang kidney. You still have 2/3. Creatinine only goes up when 80 to 90% of your kidneys are malfunctioning. And only 10 to 20% are functioning properly. So, ibig sabihin, yung 100% na blood, hindi mo na na-filter. Maski na ang normal limit, halimbawa, ng creatinine mo 133, mag 140 lang yan, 150, malaki ng area yung nagmamalfunction. So, akala mo, 200 pa lang creatinine ko. When that happens, we call that end-stage kidney failure. End-stage kidney failure or end-stage renal failure. Pag sinabing the end. Huh? So, your creatinine may be only 160, 150, 170. If the normal is about 133 or in some centers, iba yung number nila, that means malaki na yung damage. Don't take it for granted na wala pa namang 200. It is because 80 to 90% already malfunctioning or maybe blocked. So you better do something about it. I was talking with our nephrologist before. Sabi ko, what can we do? Sabi niya, so it's a depressing work, sabi ng nephrologist. Kasi they know that patient is just going to go down and deteriorate. So if it's end-stage failure, the only thing to do is replace. Either you replace the kidney or replace the work of the kidney. Ganun lang yun. Papalitan mo yung bato o papapilan mo yung trabaho ng bato. Walang other ways or means. So either you replace the kidney or replace the work of the kidney. Okay, so din po sa 6 na trabaho ng kidney, ang medicine ina-address yung 6 na yun. Now what about transplant? If you were to replace the kidneys or the kidney, isa lang yung i-replace mo, no? Has to be compatible with you. So usually family members. And
It costs about
It costs about 1.5 million peso for a transplant. I don't know kung mas mahal na ngayon, no? If you do get a kidney from someone who's close to you, you're gonna have to spend 120 to 180,000 monthly so that your body will not reject the kidney, anti-rejection medications, no? And how long do you take that? 1 year, 2 years, 3 years, and so on. So how long do you retain the kidney? Well, your body can reject that kidney, maybe in 1 day, 2 weeks, 1 month, 1 year, 2 years, who knows, no? So parang kang nag-gamble. If your body do reject that kidney, or if your body does reject your kidneys, what will happen? Nawala na yung 1.5 M mo, nawala na yung 120 to 180,000 monthly mo. It was just a gamble that you lost. Di ba yung gamble is when you bet on something and then it did not materialize. Bye-bye, no? Bye-bye dun sa pera. Bye-bye sa Okay. Ano mga causes? Infections, malabo. Bacteria, fungus, physical obstruction, I don't know what happened, no? Kidney disease is number 10th cause of death, of disease. And number 9 cause of death. Among Filipinos, it is a prevalence of 120 Filipino per million population. 5,000 Filipino patients presently undergoing dialysis. But this statistics was done in 2009. So 2010 daw mag-double. It is 2014. So who knows how many are doing dialysis? Huh? And the number one cause is diabetes. Kasi po, yung sugar in the urine slowly damages the cells of the kidneys. Slowly, no? And then damage po niya yan. And then high blood ang second cause, and then yung infection, immune system po na umatake sa kidney. And then there are other risk factors like obesity, lifestyle, poor diet, lack of exercise, and food that's too rich in sugar, asin, no, sodium, salt, and fats, diabetes, and hypertension. So, naglilid na siya sa diabetes at alta presyon, naglilid pa siya sa damaged kidney. And of course, there are also medications that can harm the kidneys, and there are also certain metals and chemicals that can harm the kidney. Mercury, lead, aluminum, no? May effect po yan sa kidney. May hindi kang magpakulo ng tubig sa iyong aluminum ware, no? Who knows what's doing to your kidneys. So what laboratory do we do? We check the BUN, the creatinine, the CBC. You will check kung mayroong protein sa ihi. Kung makita po nyo na may bula-bula, mayroong pang frothy urine, it can be protein is being excreted out of the kidney. No? For diabetics, a 24-hour urine collection would be good, no? Para makita mo talaga siya. Then of course, ultrasound to see if the kidneys are damaged or smaller than normal, and or may stone, no? And then yung 24-hour collection to see glomerular filtration rate, kung gaano karami dapat yung na-clean out na creatinine sa ihi mo, makikita po doon. At least it will give an idea how many % of your kidneys are still functioning. So sabi ni Benjamin Malmores, head of the Center for Renal Disease, ang pagpapalit sa kidney, renal replacement therapy is either a intermittent or continuous process of removing body fluid and yung mga creatinine. Now, ilang oras ang dialysis? 4. Okay. And it's done usually mga 2 to 3 times a week, di ba? Eh, ilang oras ba nagtatrabaho ang kidney? 24. How often? How many days? 7 days a week. So how can 4 hours meet yung 24 hours at yung 2 to 3 times a week, yung 7 days a week? Parang hindi magagawa. So we've had seen patients ang creatinine na 1,000, pag dialysis na baba lang ng mga 800, 700, no? Ay ang layo pa ng normal, 133. We've seen patients na after dialysis, 1,000 ang krea, 1,000 pa rin. And I've seen patient na 1,000 yung creatinine, after dialysis nag 1,200. Tinanong namin yung nephro, Doktora, ba't po umakyat? Why did that patient's creatinine na 1,000 became 1,200 after dialysis? Sabi nung doktora, the dialysate, the chemical we put so that the blood will not clog up the machine is damaging his kidney. You don't know what to do, di ba? Okay, sabi nung isang pasyente na nagda-dialysis, Doc, it's like we're not normal anymore. You know, we don't look normal, we don't look and feel normal. We look at each other with be 20 doing dialysis at the day. Then after a few weeks, 19. After a few weeks, 18. And say, oh, where's brother so-and-so? He went ahead. Yeah. And you will look at their eyes and you could not see hope. Yeah. So, I don't know what's happening, no? Okay, anong signs and symptoms? So for the fluid, when they wake up in the morning, their face are puffy and the eyes are edematous, no? And that's because of the low protein in their blood and the fluid and the water build up, no? If their blood pressure is high, then they chest pain, na masakit sa ulo, no? Electrolyte imbalance, they can have swelling in the legs, they can have change in consciousness. Minsan tulala sila, they may be delirious, no? They can end up in coma if their sodium or are down, no? Then if there's toxin buildup, it damages every organ in the body. We call it multi-organ failure. From head to foot, the toxins that leads to be eliminated will poison the system. And then makita mo, there's protein depletion. The muscles are wasting, na magiging payat po sila. Kasi you're eliminating protein through the urine. Natatapon po yung protein. So pumapayat po sila. So yung acute kidney failure, pwede daw ma-reverse. Diba, nasaksak yung patient, bumagsak yung dugo, nag-shut down yung kidney, or maybe in-expose sa drugs, pwede mo reverse yun if you do dialysis right there and then. No? Pero yung matagal na sakit, like diabetes, high blood, ang damage is permanent and irreversible. Yan. So ito po yung example. Sa iba, 133 or 1.5, yan yung normal. Potassium, so iba, sa pula ng dugo, no? Okay, so ito po yung lifestyle or life cycle of a patient who has a kidney failure. This is from a book called Internal Medicine by Dr. Harrison. Ito po ay textbook namin sa medical school. Tingnan po ninyo. Pag nasira ang kidney mo, magda-dialysis ka, either hemo or peritoneal. Yung peritoneal po, bubutasan yung tiyan, and then maglalagay ng tube here so that yung dextrose will flow into your abdomen, and then hoping na yung ating bituka maglilinis siya. Ang bituka po natin, yung large intestine natin, meron po tinatawag na peritoneum. Kumbaga po sa isaw, siya po yung tuwalya. Sinong nakakain na ng isaw dito, no? Yung tuwalya, that's the thick membrane in the where the intestine is attached, no? And then may mga blood vessel po doon, may mga ugat po yun, tapos may mga kulani. And yung lymph nodes o kulani, nag-filter po ng blood. So when they do the peritoneal dialysis, pinupwersa nila yung mga bituka, yung tuwalya ng bituka, yung mga kulani doon, mag-filter ng dugo. Then bubuksan ng gripo, tapon. So pasok, tapon. Pasok, tapon. So the patient will do it anywhere, no? Sa bahay, sa kotse, siya na ang nagda-dialysis sa sarili niya. But you have an open area here where infection can come in. Plus, it's very expensive. Yung 75 to 100,000, that was how long? Magkano na ngayon? No? Okay. Then yung isa naman, yung hemodialysis o ugat. Temporarily, they'll put a tube here and let it stay for about a month while they make a fistula. An artery and a vein, pinagdidikit po nila. An artery, nagpapump yun, no? Yung vein, hindi. So, if you put a needle here, the blood will go to the machine, get filtered, babalik siya ulit sa iyo. So, ganun po siya. So, ito yung buhay niya. Pag pwede ka na sa bahay, pag may transplant ka na, mag-transplant siya. And then, kung hindi pwede, hindi tinig ng katawan mo, balik ka sa peritoneal dialysis or balik ka sa hemodialysis. Do you see any hope there? The only hope is the transplant. Kung tatanggapin ng katawan mo siya. Pero yung ganong hope, pang meron lang 1.5 million yon. Pang mayaman lang siya. So we had in our hospital, there was a medtech, he was a young man, mga early 20s. When he saw that his creatinine was 1,000, he hanged himself.
Oh my God.
Pakamatay po siya. Hindi niya matake yung itsura ng mga nagda-dialysis. And siguro inisip niya kung magna-natural siya, mahirapan din siya. So he just killed himself. So ano ang gagawin ngayon? Doon sa toxins, dialysis, no? So dialysis yung ginagawa. Tapos doon sa tubig, bawal uminom ng tubig. Mga 2 glasses per day, 3 glasses per day. Ang normal na tao needs 8 to 10 glasses of water per day. No? Are you drinking your water? You better drink, no? Our brain shrinks pagka kulang ng tubig. In the South Pacific, if people have headache, sasabihin ng mga magulang na drink 2 glasses of water. Yun pala nagsishrink na yung brain mo. Our blood is 98% water, no? Our whole body is 70% water. Tapos bibigyan mo lang ng 1 to 2 glasses per day. So, no wonder na wala na silang pawis, hindi sila umiihi. Patak-patak na lang iihi nila. And water is the universal solvent. No? And yet, mapansin mo, wala nang ang tubig, manas pa rin yung paa. It was not that treatment to remove fluid out. And of course, they give medications, which by the way, damages the kidney rin, no? Sa high blood. And then, they give transfusion for the blood and inject also para mag-produce. Kasi po, ang kidney, meron siyang chemical inlalabas called erythropoietin. Ang purpose po nun, sabihan niya yung dulo ng buto natin mag-produce ng red blood cell. Pag sira po yung kidney, hindi siya nag-produce nun. And how long does the patient do this? Forever. Until, as long as sila yung kidney niya, mag-i-inject siya. Then, limited yung salt, bawal ang fruits and herbs kasi mataas nga yung potassium po nito. Kung tayo po ay tatake ng herbs or saging lalatundan, this is rich in potassium, since adequate yung tubig natin, we can drink 8 to 10 glasses of water, walang problema na didilute ng tubig yung potassium nun. No? Itong mga patient na to, hindi na nga lang mailabas yung 2 to 3 glasses of water. Pag kumain ka ng herb or kumain sila ng latundan, tataas yung potassium, they can then have a heart attack. That's why they will blame. I think I told you about one patient we had. Nag-insulin na siya, diabetic, 65 years old. He came to us and he wanted to be off his insulin and off his dialysis. 1 year na siya nag-dialysis. Creatinine is 1,000 plus. Bababa lang ng 1,000. So we worked with him and sabi namin, 2 months po kayo magstay. First month, we'll get it down. Second month, we'll help you with your repairing time. So after a month, magki-Christmas na and my staff would like to be home for the Christmas season. So we told them, o sige po, we have already gotten you off your insulin. We've already gotten you off your dialysis. You can go home, come back January. So we can continue the program. So umuwi siya, 1 week and a half. January, when he came back, his creatinine was normal, his sugar is normal, everything's normal. So sabi ko, if you can continue following the program, sige, I will not admit you anymore. So they did it. He followed the program rigorously. After a month, may dumating na nagtitinda ng blank herb, no? Sabi niya, ay, marami palang bawal. It seems that they're telling you there are things you should not eat. You know, when we give you this super herb, you can eat anything. Scary. No? So the guy ate everything and drank the herb. 24 hours he was swollen. So the doctor called me, said, run to the nearest hospital, have a dialysis. Second day he was dead. That's because that distributor, maybe she had had a patient that responded, maybe ang creatinine low lang, bumaba, ano? And there are herbs that can help, definitely. But she doesn't know the do's and don'ts. And so sabi nung family, sabi ko, I asked the daughter, because she visited, so what happened? And that's what happened. So I said, so what did the girl say, the distributor? Well, she was quiet while attending the wake. No? Okay. See, a little damage can be a dangerous thing. If you were to ask me what patient I would prefer to work with, I'd rather work with stage 4 cancer, no? Than kidney failure. Kasi this one you have to replace na eh. And most patients are hard-headed. No? I mean, they got the problem in the first place because of their hard-headedness, eh, no? And now, they think that a magic herb that they take is going to reverse the problem and regenerate their kidney in a